We developed it to address a problem that we as educators saw in our teaching. But surprisingly, people in practice have been extremely excited about using it in practice.
Imagine a framework that empowers nurses to climb confidently from evidence to action. Today, we're joined by the creators of the Mountain Model to explore how this innovative approach is reshaping nursing education and practice. Welcome to the Lippincott Spark, Illuminating Nursing Education podcast. I'm Dr. Kelly Drees. Join us as we ignite your passion for nursing education and leadership. We'll explore the latest trends, hear from expert nurses, and provide tools to keep you inspired. Let's dive into today's episode and continue your professional development journey together. Welcome to another episode of Lippincott Spark. Today, we're scaling new heights in nursing education with a powerful framework that's transforming how evidence is brought into practice. Did you know it could take up to 17 years for research findings to be fully integrated into clinical practice? That's a gap we can't afford. Our guests today, Dr. Julee Waldrop and Dr. Jayne Jennings-Dunlap, are here to introduce the Mountain Model for evidence-based practice and quality improvement, a model designed to bridge that gap. Julee is a retired director of nursing practice at Duke University and a seasoned nurse practitioner, educator, and editor. Jayne is a practicing nurse practitioner and award-winning faculty member at Texas Women's University. Together, they bring a wealth of experience and insight to this conversation. Welcome, Julee and Jayne.
Hello.
Let's begin our climb with the origin story of the Mountain Model for evidence-based practice and quality improvement. Julee, do you want to start us off and maybe describe the model and share key factors that inspired its development?
Certainly. If you can think about some things that frustrate you about teaching. Jayne and I had become very frustrated with trying to teach evidence-based practice and quality improvement. We felt like there should be a model out there that put these two things together so that our students would then be able to take part in improvement efforts that were sustainable. So we, as you're supposed to do, we looked for evidence. We went to the research and we found that we were actually right. There wasn't a comprehensive model like we wanted to help support what we were teaching to our students. And so Jayne, as she often does, said to me, Julee, why don't we make our own model? And I said to her, who, us? And she said, yes, us. Why not us? And I thought about it for a while, actually a long while. And eventually we did come up with a model that melds research, evidence-based practice, and quality improvement together to really support the nurse in being a team member, an expert, and even the leader of initiatives that are going to move that 17-year gap and make it shorter. So that is kind of the reason, right? As nurses, we find problems and we find gaps and we figure out how to fill them and how to, make things happen. And so we used our nursing acumen and experience to develop this model.
Excellent. Wonderful. So in describing the model, how does it differ from other evidence-based practice frameworks and quality improvement models? What's different about this one?
Hi, Dr. Drees. So it's different because it really merges the two paradigms together. So the base of the mountain is research, right? All practice change should be based on the best available research, inclusive of external evidence as well. And then it goes up, the next level is evidence-based practice. So that is that beautiful combination of synthesizing the best available evidence that's been critically appraised, combining that with clinical expertise and patient values, which, as we know, that trifecta leads to decreased costs and improved healthcare outcomes. And then it moves up into the next level, which is internal evidence, and then goes to purpose and aims and quality improvement. And then finally at the top or the summit is a flag that symbolizes dissemination. So really it has the two together, because external evidence is really important, and that's often missing in quality improvement initiatives. They're not based on that, it has its roots in industry. But then evidence-based practice is missing that sustainability and continuous monitoring. So it puts them together. But what's really unique about it is that it's an umbrella framework. So at that second EBP level, you can use other models, such as the Iowa model or, the Johns Hopkins model. And then at the QI level, you can do PDSA cycles or lean. So it really just sort of puts them together so that they're merged to try to maximize the benefits of a nursing practice change.
Let's shift our focus to the academic setting specifically. How can faculty use the mountain model in their curriculum? Can you maybe kind of walk us through what that looks like and if there's any examples that you might have?
Yeah, absolutely. The mountain model can provide a model for improving health and healthcare across all program levels. So for each level of the mountain model, there is a place for nurses with all educational levels to contribute. So if you are in a pre-licensure nursing program and teaching pre-licensure nursing students, what this model can help them see is that they are prepared to fully engage as a member of a EBP QI team in making a difference in their soon-to-be clinical setting. So they're ready. If you are teaching in a master's program, and we know that there's just, pre-licensure and advanced as far as the essentials go, but many nursing schools still have master's degree programs. And particularly the master's in nursing education is still a very strong degree. And master's prepared nurses are all becoming experts in one clinical focus area, right? And that is where they can shine as the clinical experts on an EBP QI team. And then lastly, if you are teaching in a Doctor of Nursing practice degree program, then these are the people who will be the leaders of these EBP QI teams. So you've got the mountain that not only combines research EBP and QI together, but it also demonstrates where every educationally prepared nurse can fit and contribute meaningfully to the practice improvement.
As we think about kind of that broader impact, let's talk about the actual implementation. Your experience implementing this type of model. What has been the response from schools of nursing and clinical practice settings that have implemented this model?
There's a lot of positive initial feedback, and it's new. And so, for example, I can speak about in my own program, we recently had 2 of our Doctor of Nursing practice students that disseminated via national presentation and publication their EBP QI projects that are guided by the mountain model, 1 inpatient, 1 outpatient. So for the outpatient project, it was a rural, basically mobile mammography unit that was set up. So they searched the literature, they appraised it, and they saw that this would help the problem of low mammography rates and breast cancer screening. But what's interesting about it is when they did that, and this is also highlighting that merge between EBP and QI, they saw their breast cancer rates increase north of 400%. But then they also realized the mobile mammography unit could do DEXA scans. So then they were able to get patients in for their bone density screening as well and watch those metrics go up based on, as Julie said, starting with identifying that problem. So that's one student. Another student had organ donation was an issue in her inpatient setting where there were organs wasted and suboptimal harvesting, and then just based on clinical management. And by implementing the best available research evidence in the first really couple of months of her implementation, 17 lives were saved. So both of those initiatives, just to kind of give you a brief overview, and those are from our program in Texas. There's other programs too, and there'll probably be more data coming out, but that just shows how the merge, with the mountain model can be sustainable and also just guided by that best research evidence, which is what Julie and I, kind of getting back to the story, that's what we envisioned when we were frustrated and trying to teach in good faith students, how do we do this? And, when I'm talking to her and saying, we can come up with this, she was on a run. She's a long distance runner. She conceptualized it on a run. And we're excited to see just some of these initial student-led project results come in.
And I appreciate the fact that you talked or explained that this model can be used across the curriculum in all different programs, whether you're PM through, doctoral programs, and to be able to teach our students about not only the model, but the importance of evidence-based practice and quality improvement and how it can really impact patient care, which is fantastic.
Yeah. Can I give another?
Yes, please.
The University of West Virginia is beginning to adopt the mountain model across pre-licensure, master's, and DNP programs, and in working with them to kind of determine how they might be able to scaffold this. It was really important for them to visualize that role of the pre-licensure nursing student becoming the registered nurse in practice, and how being fully aware of the whole model is so much more prepared to engage as a team member. And then in their master's programs, the same thing, right, with the expertise level. It could be a nurse educator, but it could be a nurse practitioner who's earning a master's degree, and those being those subject experts. And then again, moving on to the leadership level. So that's another school that is implementing it across the curriculums.
Have you run into any challenges as you developed the model, or had to kind of tweak it based on, feedback as you're kind of field testing it and seeing your own programs and other programs? How far has this come, and have you changed it up a little bit? And were there any challenges kind of along the way to get to this point now?
There's definitely been some challenges. And one of the things that we can own as educators ourselves is that change is hard. A lot of times when faculty look at putting in the mountain model, it's how do I update my course and all of those things. But what we have found is that the mountain model really fits beautifully into current course objectives. So say, for example, you have an undergraduate research course. Because the mountain model is based on research, those course objectives that normally if you modify them, they've got to go through committees and all these different channels. You can really fit it in there. Same with an evidence-based practice or a quality improvement course. So we've seen where faculty have struggled some to try to figure out how to release maybe something that they've used before in favor of this umbrella framework that is really reflective of the modern healthcare landscape. And as you mentioned at the very beginning, targeting those research to practice gaps. And I will say too, we currently have a Delphi study that I'm leading as part of my dissertation, and it is looking at the mountain model and some specific things such as cognitive load. Does the mountain model itself reduce cognitive load? And that research to practice gap. And it's not only surveying nurses, it's surveying 8 patient-facing disciplines, physicians, and people like that. And what we're finding just in the very beginning stages is that before you begin your journey up the mountain, it really has to be clear that you have a problem that you want to impact. What is that problem? So before we get to that research level, having a great understanding of the problem in general, the local problem, is of key importance. And so we're going to see more of that brought out, I believe, in future iterations of the mountain model. Julie, anything to add to that?
No, I think I might just go back to one of our earliest criticisms, which was, well, why is this so nursing focused? Why wouldn't this be good for an interdisciplinary model? And I'm just going to have to say it's because we're nurses, people. We're nurses. We believe that nurses really can make a difference in improving healthcare. In fact, I think we are the ones that can make the difference. And therefore, this model was developed by nurses for nurses. Certainly, others are free to use it, and Jayne is introducing it to other disciplines, of course. But that, along with the fact that we call it the mountain model for evidence-based practice quality improvement, a lot of models might be called EBPI, evidence-based process improvement, or EBQI. I felt very strongly that we need to leave the P in there because the P stands for practice, and nursing is nothing if not a practice discipline. And every change that occurs in the healthcare system is going to impact practice. So we leave practice in there to remind us of that important aspect of this work.
I like how you said, beginning with the end in mind. What are we trying to solve? And it sounds like this model really addresses that. So, as we look ahead, what are your hopes for the future of the Mountain Model and its role in nursing education and practice?
So what we really want, as Julie said, nurses, right, we're the largest workforce in healthcare. And nurses, both in education and healthcare, are poised to identify problems, to look up from their practice and look and identify that. And our hope long term is that the Mountain will be, a framework that they can use to do that, and to really foster that spirit of inquiry for nurses, both practicing nurses and those students. That's one of the long-term goals. And then, of course, also that we would be able to see where, right now we have this plethora of clinical practice guidelines and all kinds of things that tell us how to care for people in the best way. But we have not really been able to close that practice gap. And a paper came out a few years ago in cancer care, and that gap was at 15 years estimated. It's supposed to be the cutting edge. So at that rate, we've got a long way to go. And we hope that the Mountain Model expedites our journey to get the best care that you would want for your family, we would want for ours and ourselves out there for people. And it really does take an upstream focus in education, the educators teaching these skill sets. And I will say, the reason that I found Julie as a mentor to begin with was I looked at her work, saw some of the projects she's done. And as a student who was always very curious, but couldn't quite figure out some of the things, I wanted to make sure as an educator that we were putting our best foot forward. And so sometimes when I get to the end of what I know to do, I will rely on that strong experiential wisdom that she has from over 30 years to develop some of this stuff and to see it through. Julie, what would you say?
Well, I think one of the most exciting things to me that I see in the future for the Mountain Model is that we developed it to address a problem that we as educators saw in our teaching, right? But surprisingly, people in practice have been extremely excited about using it in practice. So it is being infused into health systems and clinic systems now that didn't have anybody come up through education knowing anything about the Mountain Model. So a kind of a two-pronged avenue for this model, both in education and in practice, is very exciting to me. And I see that as being a really great way to synergistically make an impact for our patients and our health system.
And working collaboratively with practice, to do so. Before we wrap up, we'd love to hear kind of your final thoughts or any examples or anything else you'd like to share with the audience. What's one spark or pearl of wisdom or key takeaway or inspirational message you'd like to share with our listeners today?
We want them to know that they can make a difference. And, we've talked a lot about education and practice, but we've had interdisciplinary partners like librarians, health science librarians that have really embraced the Mountain Model. And we really want you to challenge yourself. What could you do something different? And think about this model as a yes and. It's not choosing between evidence-based practice and quality improvement. It's really both. And as Julie said, without dropping the P and having EBPQI, that is where the change is at. And what process in nursing, in education or practice, does not impact practice? That's where the challenge is. So we would encourage you to think about it in that way and maybe open your mind to something new and give it a try and see what you think. See what kind of results you get. Our initial results have been promising, and we're so interested in what you would find.
Julie, any final spark?
I would just say to the educators, I would say one of the key ingredients of being an excellent educator is to have an open mind and to be open to new ideas and new ways of doing things. And as Jayne said, this is a and model. It is really a model that includes also research. It's really focused on research, evidence-based practice, and quality improvement, all three. And it can just be so complementary to what you are already doing. You shouldn't be afraid that it's something that will require tons of rework to integrate into how you're helping students understand how they can make the biggest difference once they get into practice.
Excellent. Excellent. Thank you. And where can the listeners find this model?
So Jayne and I strongly believe in making everything that we do that has to do with this model open access. So our articles on the model, and we have one upcoming where the model has been adapted to help with program evaluations and policy analysis as well, are published open access in the American Journal of Nursing. It's where our primary work is currently published.
Thank you to both of you, Jayne and Julee, for joining us today and sharing your insights on the Mountain Model. Congratulations. I know it's been a lot of work, and I can just, hear your passion as you describe it. We've explored how this innovative framework is helping to close the gap between research and practice, empowering both students and faculty. So thank you for that. And to our listeners, if you enjoyed this episode, be sure to subscribe and share it with your colleagues, and check out our related resources for more on evidence-based practice in nursing education. Thanks again, Julee and Jayne.
Thank you.
Thank you.
Thank you for joining the Lippincott Spark Illuminating Nursing Education podcast. Enjoy this episode, subscribe, share, and leave us a 5-star review. For more information, click on the link below to learn more about Lippincott Nursing products and services. Until next time, keep leading, learning, and making a difference in nursing education.